continue notifying contacts and in opening their cases. So that was the result of, or the reason for those changes. Any questions on those two documents before I jump into COVID updates? Okay. I'm going to go ahead and share my screen as I just talk through some data points here. Oops. 1 second. Okay, hopefully you can all see data. Okay, so as of this afternoon, we've had 3,597 individuals here in Oak Creek who've tested positive for COVID. As you can see with this graph here, this is our number of weekly positive tests. We have had a decrease in the number of new positive tests since our peak in mid-November, which is great news. We are currently averaging 25 new positive cases per day, which is a decrease. I think at our highest point in November, we were 50 to 60 cases a day on average. We've had 14,286 individuals here in Oak Creek test negative in Oak Creek, and the total number of individuals who are choosing to be tested has been decreasing as well since that early November peak that we saw. Oh, sorry, that's our 7-day, that's our new positive case average graph there. You can see that it went up. It's been going up a little bit. We have seen a small uptick in cases this week. Hard to know if that's a new trend or it's just, you know, kind of a couple of days of increased cases. So we'll be keeping an eye on that. So our current, our burden level, which is the number of new positive cases per 100,000 individuals, is 667. So we've had a significant decrease in that since early November as well. That burden is for the 14-day period from December 23rd through January 5th, and it's based on approximately 244 new positive tests during that period. This graph shows our percent positivity. So our current 14-day percent positivity is 17%. It went up just a little bit again this week, but we have also seen a decrease in that since early November. We've had 41 individuals in Oak Creek who've died as a result of COVID. Some other updates. Hospitals are reporting that while they are still having COVID hospitalizations, the number continues to be lower than it was during the surge in early November. We're not seeing that strain on healthcare systems that was very concerning that we saw when we had that surge. The alternate care facility at State Fair Park does remain open, but they have not had any patients there for the last couple of weeks. They have started operating as a clinic to provide the newer COVID-19 treatment. I'm not sure I know how to pronounce the treatment name. It's called bamlanivimab, something like that. So that's a treatment that needs to be administered by IV infusion. So they're able to do that in that facility to help preserve healthcare capacity as well. Testing updates. Good news is that our South Shore testing site was able to remain open into 2021. So we were able to work with Milwaukee County and the Milwaukee Health Department, the state and the National Guard team to obtain funding and continued staffing. So the current plan is that that will remain open at the same site in South Milwaukee on the Bucyrus campus through the end of March 2021. The schedule remains the same. It's open Tuesdays, Wednesdays, Fridays, and Saturdays. We have also been working with the county to set up a mobile testing site that will hopefully start soon. That will likely be stationed at the MATC Oak Creek campus on Mondays and Wednesdays. And they are able to do, they'll be there likely in the morning, and they will do testing of individuals who come to that facility. Vaccine updates. So the good news is that we did start today providing COVID-19 vaccines. So we are working with the Cudahy, South Milwaukee, St. Francis Health Departments, which is our plan for emergency preparedness activities, including mass vaccination clinics. We are using the testing site that's not open on Thursdays. So because we have all of that space, we're trying that out to see how that works for vaccine clinics. So we'll be there Thursdays and Mondays going forward. We do expect to receive vaccine shipments every week. So these first clinics, we are vaccinating EMS staff as well as school nurses and school health staff and the public health staff that are doing the vaccinations. Vaccine supply in Wisconsin, you've probably heard there's been quite a bit of media around it, but vaccine supply remains quite limited. So the state is allocating that to the registered vaccine providers. I believe there's around 1,000 of them across the state, and their practice is that, or their goal is to give everybody some vaccine every week. It may not be the total amount that we could use, but they want to distribute it across the state. So you know, the state is hoping to get more vaccine that they'll be able to push out to us, but for now we're able to use what they are giving us. So we are required to allocate vaccines per the phased plan that we've all heard so much about. In phase 1A, the eligible entities are healthcare providers and long-term care residents and staff. The long-term care facility staff and residents are part of the national program called the Pharmacy Partnership for Long-Term Care. So they're largely being vaccinated by CVS and Walgreens pharmacies, which is really good news because we have quite a few here in Oak Creek, and it would be very difficult for us to vaccinate all those facilities, and the pharmacies can do it much quicker. They've already started doing our facilities here in Oak Creek, which is, we're really happy about that. So we at the health department have been connecting with unaffiliated healthcare providers in Oak Creek. So people who are, physicians who are not connected to a major healthcare system, dentists, optometrists, chiropractors, those types of providers. And we will be vaccinating most of those individuals. There are several hundred of them here in Oak Creek. So good news, yes. So if you know anybody who needs a vaccine and is not connected to a major healthcare system, or even if they are, they're welcome to call us. Healthcare systems are doing a pretty good job of pushing vaccine out to their employees, so I don't expect we'll need to do a lot of those employees. Based on the amount of vaccine that's coming into Wisconsin, the state has estimated that will probably take a couple of months to get through all of the phase 1A providers. We're hoping that by sometime next month, we'll be moving into phase 1B. Maybe that will happen faster if the vaccine amounts increase. But there are quite a few healthcare providers in need of vaccine in phase 1A. The individuals and organizations eligible for vaccine in phase 1B have not been finalized yet. In Wisconsin, those decisions are made by the State Disaster Medical Advisory Committee, or SDMAC, you might have heard it referred to. They have told us that they expect to finalize their recommendations right around January 20th. You know, we expect that those will be adults 75 and older, as well as individuals in critical infrastructure jobs, but that has not quite been defined which types of jobs those are. We are receiving a lot of phone calls, especially from older adults looking to be vaccinated, as well as businesses wondering when they might be eligible. So we're giving them the information that we have at this point. We're noting their information, and we'll do our best to reach back out once we know that they're eligible and get them scheduled for a vaccine. Those are my updates. Does anyone have questions?
Yeah, Darcy, I do.
Sure.
I've seen some news reports on Fox News, even as of today, that the White House Coronavirus Task Force is suggesting that that we vaccinate anybody who wants to have a shot, anybody, and irregardless of what all these phases are, that people who want a shot should get a shot. That will help with a quicker herd immunity, and also that there's a shortage of people who are available to give the shots. So, and today on Fox News, Dr. Azar, not the Health and Human Services guy, this guy was from New York City, is simply saying that everybody ought to just get the shot right now, not to pay attention to these phases. So I think Wisconsin's doing a pretty poor job at this vaccine program. I don't think they know what they're doing when it comes to anything past phase 1A. So I would hope that your group of suburban health departments would look at those reports and say, we've got vaccines. We don't have people coming to get shots, so we need to give shots to whoever wants to have one, because my wife and I would be there tomorrow morning to get the shot, and there's a lot of other people that are like that, but we're going to have to wait, and because. I mean, heck, in California, they're trying to say prisoners deserve it in front of other people, which is ludicrous. But you need to take, somebody's got to do a better job, and I'm sure it's not going to be on the local level, because you're going to follow what the state says, and the state, I think, is clueless. That's all I got to say.
Yeah, I've heard the news reports as well. At this point, we've signed agreements with the federal government as well as the state to agree to follow the phased plan in order to receive the vaccine. So, as that gets updated and then we're given permission, we're able to vaccinate others. But at this point, like you said, it's out of our control. If we want to receive vaccine, we do have to follow their phased plan, or else we won't receive it.
But I thought I thought when the vaccines were going out to the states, that the states were going to take the lead as to how they vaccinate their people.
Yep, and that's
if you look at Florida, they've got a website where people can sign up and go get their shots.
Yeah, you're right. And I mentioned that state disaster medical advisory committee. So right now they're working on phase B. That's the group that finalizes or that makes the recommendations for Wisconsin. I believe their recommendations are out for public comment right now on phase 1B, or if they're not yet, they will be, I think, by this weekend. And so there is an opportunity for individuals across the state to give feedback on their plan for phase 1B. And then after that feedback, the group meets again to finalize their recommendations. So if you're interested, I could forward that information to you once it's out for public comment, if any of the board members are interested in making public comment. But you're right, each state does get to make the final decision about how they allocate vaccines. And I have heard that Florida is doing it quite differently than I believe most of the rest of the states.
I'm trying to figure out how to get my shots in Florida. I'm going there next Friday, going to Disney. So I'm trying to figure out a way to use my son's address so I can get a COVID shot down there. Since it'll be months before I get one up here. Okay.
Any other questions?
Darcy, when you were talking about the vaccine, I presume it's Moderna and not Pfizer?
Correct. We did receive the Moderna vaccine. We are expecting and hoping to only get that at the health department level, because we do not have the capacity to store the Pfizer vaccine. So they're largely, I believe, reserving the Pfizer vaccine for pharmacies and hospitals that have that deep freezer, very cold freezer storage capacity.
I have a few questions. Is it fine to go ahead and refer residents to give you a call for information on your plans, or?
It is, yeah. We don't have no concerns taking the phone calls. Like I said, right now we don't have a lot of concrete information to give them, except we watch the news, watch our website, watch the media. As far as when we move into other phases, I mean, certainly anyone who's eligible in phase 1A will add to our list and notify them when we have spots, clinic spots available. But anyone else, we're just giving them the information that we have and kind of explaining the process.
And did you say anything about quantity and frequency of shipments?
So we expect to receive shipments every week. This first shipment was 200 doses, and I think that today in our clinic we had scheduled appointments for, I believe, around 60 individuals. So we're trying to figure out, with this being our first clinic, exactly how many shots we can give in an hour. I think we can probably do a few more than we scheduled today. And then we put in a request for how many we want on a weekly basis. So I would think we'd be looking at requesting at least that many, probably more. But again, the state allocates based on how many they have. So there's no guarantee we'll get what we request.
And how often is the clinic giving them?
Right now, we are planning to have our clinics at the testing site in South Milwaukee on Thursdays and Mondays. Those are the dates that they're not open for testing. And we will likely be doing some vaccination here at the Oak Creek Health Department on a much smaller scale, of course, but other days of the week as well.
Darcy,
Uh,
go ahead. Go ahead.
I was going to say, so you said 60 were given. If you start to have a excess or a surplus, is there still an ability to go beyond the 1A as
Certainly,
Steve
we
was
don't want to.
asking?
Yeah, we don't want to waste any vaccine, but we do have quite a long list of eligible 1A individuals and organizations. So, you know, if we got to the point where we didn't have any more people signed up for our clinic for that day and we had extra vaccine that needed to be used, we would reach out to those organizations right away.
And question about the testing at MATC. Is there anything out there internet-wise or anything advertising the details, hours, and how the whole process is?
Not yet, because it hasn't opened yet, but once we know exactly when it will start, the testing will start there. I'm sure that we'll have a flyer and we'll put that information out. It is a mobile testing unit, and I believe it's appointment-based, but they'll also do their best to serve individuals who come without an appointment. And it's a PCR test. It's a nasal swab. Yes, but I believe it's a self-collected test that's observed by the healthcare professional who's there on site. So they'll walk the individual through the process of collecting their own specimen, and then it gets shipped to the lab for the testing.
And
okay, that's all.
Free though, right?
What's that, Jose?
The testing is free?
It's free, correct.
Yes. I'm sorry, I interrupted you again. Please finish. My other question is, when you talked about non-aligned healthcare professionals, is that Cudahy, South Milwaukee, and Oak Creek area?
The number that I gave, the 200 to 300, that's just Oak Creek. So each health department is doing their own outreach. There are fewer in those other communities. They have fewer, providers there, but they would also be eligible. Yep.
Because my chiropractor is in South Milwaukee, and I happened to be there today, and I asked him, and he said we hadn't heard anything yet. So if I were to call him, he could call the South Milwaukee Health
Absolutely.
Department.
Yep.
And would they just vaccinate him or his staff also?
The direction has been anyone, healthcare providers or personnel who are interacting with clients or patients. So, I believe that would mean like the front desk staff could be eligible.
Right.
If they had, billing staff who worked in an office and never saw clients, they probably would not be eligible right now.
No, he has a small office, so everybody interacts with the patients.
Mm-hmm.
And then they would call the health department. They'd schedule an appointment to go in and get vaccinated. And then do they schedule their second appointment right away, or how do you do that?
We're not scheduling them right away, but we'll reach back out to let them know, when they're eligible to come back. So we let them know that with the Moderna vaccine, it's 28 days after their first dose. And that, we expect to continue having those clinics at least on Thursdays and Mondays, and they'll be able to sign up for an appointment once they've reached 28 days.
And when you say the testing, is it a drive-through? I don't remember now. I did it in the summer the one time. It was a drive-through, but that was Cudahy. So
yep, this is a different, the South Milwaukee site, it is a drive-through testing site. We're not doing drive-through vaccines just because of the requirement to observe individuals after they receive their vaccine. So we're using that same building, but they park and get out of their car and then go through the testing the vaccination stations.
Okay. All right. I'll have to make sure I let them know that then. All right. I'm sorry. Anybody else? I don't mean to monopolize. Go ahead, Darcy. Please continue then. Are you done with the...
Those are my updates. Yeah, I think that we might have one guest on the line.
Oh, okay. If we have a guest on the line, please remember that it is a 2-minute limit for questions, comments. So I don't know if our IT person can let that person come in now.
Sure. Just 1 second.
And then our caller, if for some reason you are cut off, it's because you've reached the 2-minute limit.
Let's get her on. All right, Rosemary, you should be able to unmute yourself, and then we'll need your name and address for the record too.
We can't hear you if you're speaking, Rosemary. You might be muted.
Rosemary, you might have to hover towards the bottom of this. Oh, there you go. Your mic's on now. So if you speak, we should be able to hear you.
All right.
There you go.
I have a lot of concerns. Darcy, in all the tracking that we're doing, have we discerned any areas that are hot spots of infection in Oak Creek?
I mean, the COVID people testing positive really live all across the community in Oak Creek. There's not any neighborhoods or things that we're seeing particularly high infection rates.
How about nursing homes and group homes and things of that like?
Sure. Yep. Like many other communities, we have seen outbreaks or clusters of cases in many of those long-term care facilities.
And I happened to catch a comment on, I believe it was the Patch, where a gentleman had taken his mother out of an elderly community and inquired of both the facility and the health department, and no one would give him any data on other people that had been infected within the nursing home that he withdrew his mother from.
So, right, we wouldn't be able to, nor would the facility be able to release the names or information of someone.
We're not
who tested.
asking for the names. We were asking for numbers.
So we don't release the numbers of particular facilities, but facilities are communicating with residents and families.
Why are
when
you
they
not
have
releasing
positive.
the numbers?
Well, because that's not something that affects the general community. The residents are informed when there's.
It does affect my problems within the community, and HIPAA does not prevent you from giving me information that I need to know. If there were 20 people in my mother's facility that only contained 30 people, I need to know that number. Why are you holding that number?
Well, we're not communicating directly with the families of residents in the facilities. That's the responsibility of the facility.
This is when I call you as a member of the community and ask about that facility. You are not releasing that information.
I think the 2 minutes are up now. I saw the clock. And so
Jose, this conversation is important enough.
Thank you for your comments.
This is Steve. Can I just ask a question of Rosemary? Are you there?
I would love to comment, but I think I'm blocked.
We can hear you. Go ahead, Alderman Kirkowski.
And Rosemary, I'm not. This is inquisitive. This isn't argumentative. But my mother-in-law down in Florida is in an assisted living facility, and they provide us the numbers of all the people in the facility that have tested positive or are on quarantine and on what floor. How come your mom's facility isn't providing you that information?
That is what I'm asking.
No. How come you are not getting it directly from your mom's facility versus you trying to go to the health department? How come they're not telling you that information?
I don't know, Steve.
Okay, I'm not trying to be argumentative. I just want to know, because maybe they should be telling you, we've got 30 people in our facility and 20 of them have tested positive. They ought to be telling those who have either the power of attorneys or the next of kins or whatever that information. Again, I'm not trying to be argumentative, but I don't think the health department should be telling you what the number of cases in your mom's facility is. It should be the facility ought to be telling you that information. That's all. I'm not trying to be argumentative, but if they're not telling you, then I don't know. I would question why.
Well, Steve, when I can't get the information out of the facility, then I know that my health department has that information. So why isn't our health department revealing that information?
Right.
They're telling me that it's HIPAA, and that is not true.
Then I think you need to go back to that facility and ask them why they can't provide you that information. Because I think that as a caregiver, well, you be the next of kin or power of attorney, whatever. I think you should have a right to know from the facility.
I believe it has something to do with Wisconsin state law and protection of the facility. But the health department also gathers that data, and therefore the health department should release it to me. The health department is supposed to work for us, Steve.
Okay.
Why is the health department holding it? I'm not being argumentative. Arden is in Flint, Michigan, and he is in a retirement community also. And when they have a problem, they identify which unit. Fortunately, Arden's unit has not been affected.
Yeah. Okay. Well, all right. We could beat this horse to death on this question.
I know, but Steve,
okay.
Government works for us. Right. So therefore, government has the data. They should give it to us. What is our health department doing? They are collecting, tracking data. They have not identified any hotspots, and they will not give us information. That is up to you guys, our aldermen, to make them tell us what's going on in our community.
We have
Steve, come on.
What they do.
Rosemary, I think she's given us the information.
She hasn't given us the information.
No,
she's not.
She's not being as specific as you are demanding her to be, but she's providing the information.
I demand her to be, and I have a right to demand her.
Then you have a right to demand from the healthcare facility that information. Okay.
That's not true, Jose. You are wrong.
End of discussion. Okay. Thank you so much.
Well, can't put that worm back in the can, folks. Sorry about that, but I was just trying to ascertain as to why the facility isn't giving her the information that she wants, because I think that's where that information needs to be obtained from, personally.
Right. And just to clarify, we do work with the facilities. We make sure that they are giving notifications to their residents and families. And if we have concerns about that, we work with the state and the Department of Quality Assurance, who is the licensing board for those facilities, to make sure that they are following all of the requirements and the protocols. Similarly, when we work with businesses, we don't release the numbers of cases in any businesses or long-term care facilities. We handle those the same across the board. Same with schools. They've chosen to release that data themselves, which is perfectly acceptable, but it's not our practice to release specific numbers for specific businesses.
So Darcy, if you were able to, and okay, let's assume we have a situation here where you're getting information from healthcare facilities, and you're being told by these facilities that they are sharing information with the families of those people that are residents there. Yet you have a resident in our city who is claiming that that facility is not sharing that information. Is that something you can go back to that facility and say,
right,
hey, this is a situation, you're not telling your families of your residents this information. That's your job to do that.
Yep, we have done that. Yep, several times. Okay. We receive calls fairly often from family members who have understandable concerns about their family members in those facilities, and then we work with that facility to make sure that they're messaging appropriately. And that's where I said, if we have concerns, we escalate that to the Department of Quality Assurance, who's the licensing board, and then they are very actively involved in that process as well.
Well, then maybe if you probably know the name of the facility Rosemary's talking about, and maybe you could give them a call and share with them our meeting that we had and our residents' concern, because I can't do anything as an alderman. I mean, they're not going to listen to me. They're going to go, okay, thank you, and hang up on me probably. So maybe if you can make that phone call and find out if someone's telling the truth or not. I don't know. Not saying anybody isn't, but one hand is saying yes, one hand is saying no, and I think you know where I'm going with that.
And also too, I think that the only information that the health department could provide is that there's 10 cases at this facility. Anything beyond that, they don't know. And
I don't think Darcy's even identifying facilities, are you? You're just saying you've got so many cases in the city, right?
Right. We're not, the state is listing the skilled nursing facilities that have outbreak on the state website. So that data is shared by the state, but we haven't been posting that data regularly from the health department.
So then the caller can go to the state website and get that information.
Right. I don't believe they have the number of cases, but they are identifying facilities that are experiencing outbreaks, which would mean that they have positive cases in the facility.
So then she can go to the state and ask them if that's something that they can provide her. Thing is, though, that depending on how detailed information the person wants, that may be a violation of HIPAA. Is it my mother's roommate? That is a violation of HIPAA. So they can only provide so much information. I know the caller's still there. So it depends on what you're asking for. If you're asking for very specific information, they may not provide you that information. So I'm sorry if, and thank you, caller, for your questions. Anything else from the committee? Otherwise, we're going to go on to environmental health updates.
All right. Hi there, everyone. Well, since our last meeting, I issued 7 new retail food licenses. So there's still a lot of activity going on as far as businesses starting up. And that currently I've got 5 kind of in the works of retail places looking to open up, and 1 restaurant in themselves looking possibly sometime this month to open up down there on across from the Franklin Hospital on 27th. So that's hopefully sometime this month. We did lose 1 restaurant, the Pizza Man. I don't know if you probably all heard that. They closed this past weekend. So other than that, it's been kind of a slow time of the year somewhat. So yeah, chugging away with this. Has anybody got any questions at all for me at all? Okay, thank you.
I hadn't heard about Pizza Man, but that's kind of a shock.
Yeah, they already took the signs down and everything. They're already down.
Anybody questions? No. Okay. Anything under old business? Nothing? Anything under new business? I just have a comment for the lady that called. The health department, yes, does serve the community. We do, and that's what that's what the health department does. But in relation to a person's dispute, concern, issue with a healthcare facility, that is not the health department's purview to get involved in those matters. That is between you and the healthcare facility. Please do not come and tell us we have to tell you this, because that is between you and the healthcare organization. And I know she's still on, and that she needs to settle it with them, because that, again, is information that should be received from the facility itself, not hearsay or information anecdotal from other sources. So if there's an issue with the facility not communicating with you, then that's something that you need to deal with the facility and other resources that you can utilize to have them give you the information you need. And then that's how that is. But again, asking outside sources to give you that information doesn't help at all with finding out why it is that the information is not coming forthrightly, or excuse the term, from the organization itself. That's just a comment, a personal comment. So, you know, I work in a healthcare organization. I worked in healthcare for many years, and that information needs to come from the healthcare facility itself. And if it doesn't, then that's a problem you have to deal with them. And I'm sorry, I will stop now. Anybody else questions? Other things, any comments, anybody? I appreciate the caller's concerns, and I do share her concerns. I really do. I do not mean to disregard her issues, but again, you know, please deal with it with the appropriate group. Anybody else? Questions? Anything?
I had a question for Darcy. You mentioned you're keeping a tally of COVID-19 deaths in Oak Creek.
Right.
Do we do a similar thing for every annual flu season?
We don't always know about flu deaths. So with COVID, we get a report, and the medical examiner gives us a daily report on deaths across Milwaukee County. And you know, with flu, we don't handle flu cases the same way as COVID. So we only are notified of someone who has the flu if they're hospitalized.
Right.
And then we don't get a specific death notification. So I know the state tracks influenza deaths every year, but that's not something that we have the ability to do.
Anybody else? Last minute comments? Our next meeting is scheduled for Thursday, March 4th, 2021 at 4 p.m. Otherwise, if there's no further business before the board, I'd entertain a motion to adjourn.
Kirkowski make a motion to adjourn.
Do I hear a
I'll
second?
second.
Thank you. Any other further discussion?
I'll have a Mickey ear for everybody this coming week
All right.
down there at Disney.
All righty. Thank you so
Safe
much. And all in
travels.
favor of adjourning? Aye.
Stay safe.
Aye.
everyone.
I will be safe indeed.
Opposed? All right. Thank you, everybody. Appreciate it.
Bye
Thank
now.
you.
Bye.
Good